The COVID-19 pandemic has affected healthcare charities providing services to migrant workers in Singapore. HealthServe has seen its pool of volunteers shrink. Isabel Lim finds out what else has changed.
It's very early, 3 p.m. I give token. Okay? So today, no dentist. Today, no dentist. Okay?
Jana Benares has been with HealthServe since 2015, and in that time, the clinic manager has seen her fair share of migrant worker patients. But with the COVID-19 pandemic, routines have been tweaked.
Most of them will queue as early as 11 in the morning, so the giving of queue numbers for this period of COVID changed from 5:45 to 3 p.m.
The clinic officially opens only at 7 p.m. Other changes have also been implemented, like separating patients who display respiratory symptoms.
Here is it?
Nose, flu, fever, cough.
Okay.
All take there.
Another change?
3:10 in the afternoon. So I'll be gowning up because I'll be seeing them as early as possible, as early than usual.
Full personal protective equipment is required now. HealthServe says most of the PPE are donated. At 4 p.m., patients reporting respiratory symptoms are seen.
We did a preliminary triage for all the flu patients or with flu symptoms together with Dr. Ben. So we take out their vital signs, their complaints. Then we prepared a template and the memo. We will be asking the doctor on site later to double confirm those cases that we are not so sure if to send or not to send to NCID.
How many are there?
So far we have triage 10 with flu.
It takes more than an hour. Jana takes a break for dinner, donated by a charitable foundation, and not long after, she's back in a fresh set of PPE.
Hello, we're preparing every volunteer now, clinic assistant, to put on their full PPE.
The team for the night huddles for some quick instructions and a prayer. They then disperse to their stations. The on-site doctors begin work at 7 p.m. and confirm with Jana which patients need to be sent to NCID for further testing for COVID-19. She makes the calls.
Now 37.5 because he took Panadol in the afternoon.
And not long after, 3 ambulances arrive. Volunteers hand out care packs containing items like towels and a prepaid SIM card to patients so they can keep in touch with family.
Take care, brothers, okay? Take care. All right, no problem. They will take care of you.
After ensuring patients get into the ambulances and others have seen a doctor, Jana and the team call it a night close to 9:30 p.m.
Glad to have served, I think tonight about 35 patients. We sent about 7 to NCID. Right. So yeah, calling it a night and let's rest up, and hopefully next week will be better in the sense that it's just tiring.
There's a final debrief.
How are we today? Anything any like improvement or highlight? Any patient that you encounter struck you?
They take a moment, and next week they'll do it all over again.
Sacrifice to come and serve the migrant workers, and thank you for their hard work.